Folks, thanks for coming on with us today. My name is John Dubas with Premier Marketing, and we'll be spending the next hour or so discussing one of the basic pieces of background information that we need to effectively market in a Medicare insurance type of program space. And we'll be spending that time going over a number of different functions, some different basics on Medicare itself, some ideas on how to present yourself in this space, and then some of the additional information you have from our organization. As a bit of housekeeping, today's presentation is being recorded, and it, along with much of the information that I'll reference throughout the course of the presentation, will be sent to everyone who has expressed interest in today's presentation. So watch for that as soon as the recording to today's presentation updates. Hopefully we can still get that out to you today as well. So a bit of background information about our organization to start. Premier Marketing is a national marketing organization founded in 1968. We're part of the Integrity Marketing platform that has offices across the country. And we act as an insurance wholesaler, offering insurance contracts through independent insurance agents at the highest possible commission levels, with recruiting contracts available to those who qualify. As I mentioned, we were founded in 1968, so that means, well, recently we've celebrated a real milestone in the history of the organization, our 50th anniversary, and what started as a small family agency in rural Nebraska has become one of the premier marketers, no pun intended, in the Medicare space. That includes offering a full insurance portfolio in the Medicare arena of Medicare Advantage, Medicare Supplement, and PDP programs, standalone Part D plans. We also offer a full portfolio of life insurance and annuity products, including final expense and pre-need plans, long and short-term care programs, disability income plans, and ancillary benefits, including dental, vision, and hearing programs, critical illness and cancer plans, and hospital indemnity programs. That Medicare Advantage portfolio includes all the national carriers and many of the strong regional carriers that make a difference for you in your market. And that same philosophy carries over into the standalone PDP arena, where those national carriers are there for your use through our organization with our support. That same philosophy of support carries over into the Medicare Supplement portfolio, a very robust area where specific tools are set up to help you be successful in that space as well. The ancillary products, they walk hand in hand with any of the basic types of medical coverage that are offered to individuals, and it includes the major carriers in each of those subsections. So you'll see the folks you need to cover those gaps that aren't part of a full medical insurance program are available to you through our organization. As a kind of an overview, when we look at the Medicare market overall, you don't come on a webinar like this or visit with a carrier representative without them speaking to the incredible opportunity we have in the Medicare space. The baby boomers are obviously aging in, 10,000 plus people a day, one every 11 seconds, I think is a statistic, easier said than done, that I've heard recently. And when we look at this, we have to realize that it's not a true indication of the space that we're working in, because there are people that tend to work past the age of 65, don't access their Medicare benefits immediately when they're eligible, so that number might be a little distorted in that sense. But we also have the medically disabled, where 1/6 of the Medicare population is actually under the age of 65, and they're in dire need of our help as well. It gives us the idea of such an intense, diverse population that we serve with Medicare coverage. And we see on average with these people that they have different challenges we need to address. And having the information about the programs helps us do so, and having access to a variety of programs makes us even more effective. Because if we look at this, well, 2/3 of the Medicare population has 3+ chronic conditions, and a good portion of them have a little bit of a challenge when it comes to their income and assets as well. When you look at a median income of 26.2 for this population, we need to help them be able to budget for the inevitable expenses that they're going to incur in the future. And we can do so because we have that variety of programs. Because if you get deeper into it, some of the folks have more challenges even than the basic beneficiary we visit with every day, both once again with health circumstances and income. So when we look at Medicare overall, when a person accesses that coverage for one reason or another, and let's, in this particular discussion, speak to the folks that are aging into Medicare, they have a number of choices that they can make. And an old sales manager of mine many years ago with Prudential used to say, the decision to make a decision is a decision. And that's really true in this particular circumstance, because folks can really start off clear at the very beginning, making a decision on whether or not they're going to access their Part B benefits, because that is a elective coverage. Most folks do. Some folks miss that opportunity and pay for it later, but then they have to decide, what do I do about the gaps in my coverage? What Medicare doesn't cover comprehensively, be it on medical procedures or on drugs. Many of them will pick up a standalone Part D program and perhaps cover the challenges with some of the shortfall on the financials on the medical through a standardized, modernized Medicare supplement, a Medigap policy. Pay the premiums and go forward with that. Some will choose to self-insure for that difference, and then some will take the route of going into the Medicare Part C program, the Medicare Advantage program, which in many cases integrates the prescription drug coverage right into that coverage as well. So they have different choices that they make. Sometimes we see that agents' own perception of those different programs will influence the way that a presentation goes, and that's the way it works sometimes. But we need to make certain that we can purvey the information, lay out what our prospects and clients need in order to be informed to make a good decision for them. Because what we're seeing with research, this particular piece provided by Def Research 2019 information, it's a fairly even split between Medicare Advantage and Medicare Supplement programs. So having a variety of programs at our disposal will be very helpful, but most certainly knowing the differences between the two choices and the fine points of why you want to do one over the other can make a difference as well. It's also important to note that there's a percentage of folks that age in to Medicare that don't pick up either. And there are reasons for it, of course, and that is why we need to know more about that population, why they're making some of the choices that they have. Well, you have obviously some people who will look at the base coverages because that's the route they have to take, but there are a percentage of people that may have retirement coverage, maybe getting additional assistance from the government through other types of subsidy programs, maybe veterans. There may be a number of reasons why a person doesn't select one or the other options that most do moving forward. And it's one of these situations where it's important for us to be up to date on the information that we offer and be prepared for the questions that our prospects and clients have. Because quite frankly, we have to step out of our own perception of some of the programs and make certain that our prospects know they have different choices and what those choices are. So we'll spend some time then getting back to the basics and going through some of the background on the Medicare program and the cost and options that are associated with it. One of the first things we need to address is the language. And much like any subset of society, if you dive into a particular area, there are acronyms that are part and parcel of that conversation. And sometimes, boy, it's just, what are they? Can you have a translating guide here for me? Well, part of the things that we have available for you are basically definitions of some of these acronyms. And that might be sounding really, really remedial, but knowing these can be very helpful as well, because, well, from time to time you may read communications is the word I was trying to say there, that will be necessary for you to help translate for your prospects and clients. And you have some different guides that are very helpful for you. Many agents who work in the Medicare space will consider this as, and I don't mean this sacrilegiously, a bit of a Bible for this part of the industry. The Medicare and You book that is sent to every Medicare recipient every October, unless they opt out for a electronic version now, gives them a ton of information to help with their choices. It is, of course, an option that not everybody reads. So when we think about the things that we have with our own coverages, when you get your policies, do you read through everything? Do you watch every video that's available? Nah, probably not. Neither do these folks either. But this then can be a great tool for you to not only to help reference during the course of a conversation, but also give you some of the information you need on different pieces of the programs that are available, how they work together and separately, and the different costs associated with specific questions as well. So this, though many of you may have it already as part of your library of resources, will be one of the things that we send as follow-up to today's presentation to help you for reference. When we look at an overview of Medicare itself, the legislation that was initially signed into play by LBJ back in the mid-60s is, boy, it's different. And so let's look at some different milestones that have come about through the course of Medicare itself. It was created in '65 specifically for folks 65 and older, regardless of income, medical history, health status, and it has grown to become a very large part of our government's expenditures, total federal spending. And we look at it as, well, Medicare itself, 15% of the total federal spending in 2017, 20% of the national health spending is in this area as well. It's mutated from that initial type of coverage that was set into play in '65, adding additional eligibles to the program and additional covered benefits as well. And this is how it can appear to some of our beneficiaries. Might as well be another language in many circumstances, and that's why we as agents will act as translators as well. So what we have now is a program that for most people 65 and older, if they're entitled to Part A, well, they're doing so in many circumstances because they have paid a premium for 10 or more years, and it self-funds the Part A coverage. We'll talk about specifically what that is in a moment. People under the age of 65 who receive Social Security disability insurance generally are eligible for Medicare after a 2-year waiting period, with certain exceptions for certain health circumstances. ESRD folks and folks with Lou Gehrig's disease. Those folks can get the coverage immediately as well. Boy, simple path to take at 65, isn't it? We're throwing a couple of these slides in there just to reinforce the fact that it can be a bit of a challenge to work through some of the information that is sent to an individual. For us as agents, when we look at the Medicare program overall, we look at it and consider two different categories. The traditional Medicare piece, which is the A and B, the hospitalization and medical coverage, and then look at the Medicare Advantage and prescription drug coverage, the C and D. Medicare Advantage being the Medicare Part C, the drug plans Part D. We have some key differences on how we can work with the different types of programs that address these two categories, because there are different pieces of legislation and marketing and conduct oversight for one or the other. We can do some things with traditional Medicare product that we can't do with Medicare Advantage and prescription drug programs. There are obviously differences between the products themselves and how they operate, and with election periods, with enrollment periods as they apply to these two different types of programs. We did a webinar yesterday on the special election periods that affect the enrollment of these types of programs. That link to that presentation will be part of today's follow-up as well. And then, of course, how we can become eligible to offer the programs, in a manner of speaking, can vary as well. The licensing and certification processes can vary from state to state, and obviously, more particularly, between the two types of categories that we're referencing. The Medicare supplement world doesn't generally require annual certification, one major exception there, where the Medicare Advantage and prescription drug programs, even once you get into it, you want to maintain your renewals, will require annual certification. So some things to consider as to what type of programs you want to use to address Medicare itself. So when we look at the different parts of Medicare, Part A covers an inpatient hospital stay, skilled nursing facility stays, some home health visits, and hospice care. It's an interesting consideration because right now, if someone joins a Medicare Part C program, the hospice care, there's some different things that can come into play as to who pays what. The Part A benefits themselves are subject to an annual deductible, or per stay deductible, I should say, and that's $1,408 in 2020. Part A also requires coinsurance for extended hospital stays and SNF stays. We have some specific dollar amounts for that later in the presentation. The Part B coverage, that handles physician visits, outpatient services, preventative services, and a split of the home health visits. Many of those benefits are subject to an annual deductible as opposed to the per stay deductible with Part A. In 2020, that's $198 a year, and typically coinsurance of 20%. No coinsurance or deductible is charged for some of the annual wellness visits or preventative care that the government sets up in different categories. So what we see off the bat are some of the reasons why people look for additional coverage from what they get with just traditional Medicare. Because one of the things that's not noted here is neither of these coverages have a maximum out-of-pocket. So those percentages and those co-payments continue as long as the person is accessing benefits through Medicare. When we look at Part C, that's the Medicare Advantage program. This is a program where beneficiaries enroll in a private health plan where a company then receives all the compensation for that program, determined on a per member per month basis based on how old the person is, where they live, certain health circumstances come into play, whether they're a boy or a girl, and they'll look at an average cost of care and pay a private company then to assume all of the costs of that beneficiary's care. This is a program that in the past had different names. It's gone through some different incarnations when it comes to some of the funding. And right now, it's an exploding part of the area of care because, well, in many circumstances, the plans are available without premium, additional premium by the beneficiary. And it's covering now more than a third of the Medicare beneficiaries that are in Medicare. So it's a big deal with a lot of different companies. That's a poor way to put it, but it's a burgeoning part of the programs that we have available and what we can make available to our prospects and clients. And I apologize, I'm getting notification that we're having some audio difficulties. Hopefully we'll be able to work that out here in just a second. The Part D program covers outpatient prescription drugs. And these are private plans that contract with Medicare to offer the standalone prescription drug programs and the PDP programs through that contract with the government. It pays for the enrollee's drug costs with certain minimum coverages that are made available. There are assistance programs that can help with the cost of those programs for people with low income and modest assets. And the individuals that come into these programs, if they aren't eligible for that situation, well, they have an opportunity then to shop different programs for different monthly premiums and cost sharing on their prescriptions with cost varying by the plan. This is a voluntary program, so a person isn't automatically enrolled in drug coverage. And we see that in 2018, of about 55 million people on Medicare at that time, 43 million were enrolled in this program. So of those folks enrolled in drug coverage, about 1 in 4 receives those low-income subsidies that help with some of those costs. It's important to note that the benefits in these programs can change year over year, and that's why a role of an insurance agent or an advisor can help people find what may be the best plan for them, because circumstances vary. This gives us some evidence of the popularity of those Medicare Advantage programs from Kaiser Family Foundation, the percentages that are enrolling into this type of coverage over the years, and we see some of the things that came about during the Billary administration, meant in humor and not sarcastically entirely. So some different things that come into play, and why we as insurance agents need a rounded portfolio to help people, because folks then can take different tracks to cover that shortfall in the coverage. As we noted on a much earlier slide, where we have some challenges with the choices that people make, sometimes the decision to make a decision, well, a lot of that is predicated on having the information that is necessary to make those choices. And what we see is if a person doesn't do anything, they're going to come out of pocket, in many cases, a great deal of money. One of the things that we see on a regular basis are folks who are aging into Medicare. In many cases, in the latter part of that time period, they may not have had other health coverage. And so they are actually fervently waiting for a guaranteed type of coverage like Medicare to help them with their costs. And as they get older, those costs rise. So we will see different choices available to people at different ages that might be more appropriate in one sense or another, because the government itself funds that basic coverage, and it comes from different sources. This gives you an indication of the dollars that go into the Medicare program and how that's being funded. You will hear many times pieces of news as to the fund for Medicare being a little precarious, having some different challenges that come into play, and we see then that a lot of this is financed by the working population. And so as our overall population ages, we have fewer people working to fund this, because look at that. General revenues cover 41% of it, but payroll tax contributions of 37%, where the people that are on the coverage, well, their premiums, which may be a economic trial sometimes, is only 14% of the funding. So it's the working population that takes care of the previous generation, in a manner of speaking, and that can be a challenge moving forward. So the Part A coverage itself, which is the hospitalization coverage, is funded mainly by a payroll tax on earnings that are paid by employers and employees. It's deposited into the hospital insurance trust fund, and higher income individuals pay more. We'll have some additional information on IRMA and how that affects specifically the folks that are higher earners, and how adjustments to that are being considered as a way to help keep the trust fund solvent. When you look at Part B, it's funded generally by general revenues and beneficiary premiums. The standard premium for a Medicare beneficiary for Part B in 2020 is $144.60 a month. There are different programs available to help beneficiaries who have lower incomes and assets challenges. We'll go into some specifics briefly a little later, but folks who are earning an income of greater than $87,000 as an individual, or $174,000 as a married couple, these are the folks that are subject to those higher premiums for this coverage. It not only affects their Part B premium, but also can affect the cost of additional plans they take on. So the Part D coverage, there may be a surcharge on those premiums as well. Part C, well, it's not separately funded. Medicare Advantage programs, they receive that full benefit package that they put out to the beneficiaries, but they are financed primarily with the same mix that we see on A and B, but these folks have a premium that is funded based off of those laws of averages based on their statistics. So some of the things that we see are variables based on an age and sex, location, that sort of thing, health services. And what we're seeing are these programs are having some success in managing costs and managing their own premiums. So that is a circumstance where the cost of these programs are being maintained year over year. What we see in the industry is more of a change perhaps in annual benefits, because while Medicare supplement programs are standardized, these programs, the benefits themselves are more left at the discretion of the private company that is offering the program. That same kind of circumstance pretty much is an explanation of the funding for the drug programs as well. Since they are an elective program through private insurance companies, you will see that same sort of movement year over year with these programs. And that's one of the reasons why this past year, some of the evaluation tools made for us or left for us by the government, the Medicare Plan Finder, became such a challenge that we have. So we have funding challenges with some of the programs themselves long term because of the aging of our society, but right now things tend to be pretty stable. How we look to leverage this market? Well, we got to get our duckies in a row and make certain that we know the base coverages that we have in this area. And that gives us then the opportunity to access different resources. We're going to lay those out for you here. Read, study, practice is always good. And then make certain we target the parts of the market that fit our overall marketing strategy for our agencies. It's important then to investigate different contracts with different carriers, different marketing organizations, and leverage some of the support you can get from those that are part of that contract, your marketing hierarchy, and the companies offering the products that you are proposing to your prospects and clients. So there are a ton of different ways that you can go in and get that information. One of the pieces that are available for you are through the government itself, through CMS. And they have some wonderful training programs that can be very helpful for you. And this is a piece that's often overlooked because this is a way for us to make certain that we stay up to date, and also gives us the opportunity to access different training modules that we can use in our conversations with the public in a generic sense. You'll find many materials that are made available through different carriers, but many circumstances you have greater success in marketing to the general public with offering explanations not only about the programs that you're offering, but the basics of the programs offered by the government themselves. And I got to tell you, there's a plethora of them. We use them a lot when we market in the community space, when dealing with centers of influence in the community, and they're available for you. They do also offer different webinars on these topics. When the changes came about with the Medicare Plan Finder, they were an invaluable resource in making those pieces of information about the changes of that tool available to the not only the beneficiaries, but to the advocates that work on behalf of that population. So you have some different things that come into play. This information and then that website access will be sent as part of the follow-up as well. So you have an opportunity throughout the course of this presentation, not only to access some of this information directly from the source, but you will be getting a PDF of this presentation as well, where some of the slides that may be of particular value to you can be printed off as well. These are examples of some of the training modules that are available through the National Training Program, the CMS NTP site. You have a basic understanding Medicare piece, one for helping people understand about how to get started with Medicare, how Medicare Advantage and other health plans work. That same sort of type of concept for Medigap or Medicare Supplement programs, and the prescription drug program as well. You also have other organizations that kick out some really good pieces of information for you. The National Medicare Rights Center is trying to kind of describe this. Well, for one time in my life, I'm kind of at a loss of words. It's a fairly liberal interpretation of some of the benefits. They're a huge advocate for the population, but it does extend into their own type of mind as to what they're advocating for, if that makes any sense. But if you access additional information from the National Council on Aging, they have great generic presentations for low-income subsidy and Medicare savings plans and other pieces of educational material that you can use with the general public to help in setting up those educational seminars throughout the community using that presentation. Carriers have it. We have some examples of some of this coming through too as well, but these are great, great resources for you. I mentioned the different carriers that have different pieces. This is a website that is attached to United Healthcare, the Medicare Made Clear website, but it has a ton of resources that if you're contracted with that carrier, these are fairly generic in their presentation. They don't go into necessarily specifics on Medicare programs with United. They got other things that'll do that for you. But there is a piece with this where the presentations are also available in hard copy, and those hard copies are available to contracted agents without cost. They ship them to you. There are quantity limits, but working with local management of the carrier and your upline can make this information available to you. Other carriers do this similarly, but United has been doing it for a long time, and they got a ton of stuff out there that can really help you. Here's a basic presentation on a Show Me guide that helps walk through some of that information that's made available by United, a version from Aetna with a Medicare 101 one. Anthem has some similar type of presentations. You have different carriers across the country that make Medicare Basics available to you. Humana has not only these presentations that address their product portfolio, but a great 101 piece as well. And for many people, you're seeing a great amount of emphasis being placed on the dual folks. These are folks that receive both Medicare and Medicaid. You have a number of carriers with greater emphasis of working in that area, and they are making certain that they have tools for you to work not only the D-SNP area, but the C-SNP area. Remember that slide early in the presentation that speaks to acronyms? These are different types of special needs programs that can speak to programs that are appropriate for folks that fit the criteria for those plans. So you have some different things that can come into play. And then, of course, there are people that will make their own presentations. This is one that is borrowed from one of the medical groups that I've worked with in the past, and it gives you then the opportunity to place yourself as a subject matter expert in your target market by not only delivering the information you need on the programs themselves, but why they want to work with you. What makes you different? Well, I like to stand in front of bushes, evidently, but some of the experience that we have can roll into some of the choices that make good opportunities not only for sales, but for the population we serve, making certain that they have programs that fit their needs. So when we look at some of the specific cost of Medicare, these change year over year. And what we see for 2020 is subtle increases for the different parts of the program, what comes out of a pocket of a Medicare beneficiary that doesn't have additional assistance. So what we've got here is if people hadn't worked that 10-year period to fully fund their Part A or been married to someone or access it in another fashion, people can actually buy into that coverage, and they can pay up to $458 just for the Part A coverage. And you can see that periodically as we go through things. The vast majority of Medicare beneficiaries, that's not an issue. It doesn't apply. In 2020, for that Part A coverage, for a hospital stay, we mentioned that there's a per stay deductible per benefit period of $1,408. It covers the first 60 days of a benefit period completely. If a person stays in the hospital too long, and I know many people say, well, gee, they kick you out of the hospital real quick. Not always. And if people are in there for a period of up to 90 days, well, days 61 through 90, they're going to pay an additional $352 a day on top of that deductible. And if a person goes longer than that, they have a certain number of lifetime reserve days where they're going to pay $704 per day after that period, and you get 60 of those days during your lifetime. One of the things you'll notice is those tend to be multiples. So you got 0, 352, then after 90 days, it doubles. Then after the lifetime reserves are come into play, you can look and see how, well, gee, even the deductible is a multiple in those areas. Skilled nursing facility stays, there are different requirements for this than you have with Medicare Advantage programs, because a skilled nursing stay generally is predicated, that coverage, by having a 3-day stay in the hospital before that coverage would kick in. The first 20 days of those benefit periods are covered entirely. You have an additional 80 days of coverage where you're paying $176 a day. Then after that, it's out of the beneficiary's their pocket. So out-of-pocket costs, and these are reasons why people look for additional coverage. In the Medicare Part B world with the medical insurance, you see this as an area where the monthly premium for that Part B can change year over year, and generally does. Some of it's tied to the COLA and Social Security. Some of it just absorbs that amount. And what you see is a monthly premium of $144.60. And there are some folks who have gotten Social Security benefits that pay less than that even now. And Social Security lays out what that premium will be for an individual. You pay that standard amount. If you enroll Part B for the first time in 2020, you don't get Social Security benefits because you don't have to file from them. And gee, there's a lot of things out there telling us that as those boomers age into that now, you should actually put it off to get full benefits with Social Security. They are billed, those folks, since if they're not taking Social Security and it's not deducted from it, you're billed for that on a quarterly basis. And if you have Medicare and Medicaid, Medicaid will pay that premium, as will some of these other Medicare savings programs. So it's based off of the modified adjusted gross income as reported on our IRS tax return from 2 years ago. So it cycles through. What we'll see is some people, as they age into the area of consideration here, oh boy, do I take this now or not? If they sell a vacation home or some other windfall comes about, you can see that Part B premium vary from year over year. This is the chart that lays out those income parameters and the premium difference paid. So you'll notice the standard Part B is $144.60. For folks who are high earners, well, they are also high payers in this program as well. This is the excess premium that's charged for the Part D programs. Remember, we said that the income levels can influence the premiums charged by those private companies for the drug coverage. This lays out that surcharge as well. So we have a lot of talk in our society now about the higher income individuals paying more. In this circumstance, they already kind of do. And one of the things we need to be certain of as we work in the Medicare space is, okay, what are the rules of the game? Am I going to get called for clipping if I do a block inappropriately? Yeah, there are some different things that come into play that when we work the Medicare Advantage and Medicare prescription drug programs, we need to know when we can sell something, how we can represent it, and what marketing tactics we can use. So there is a piece available, the Medicare Communications and Marketing Guidelines, that many of the carriers will refer to. Some of them will interpret different pieces of that a little bit differently. And if we go to use outside marketing sources, mailing houses, some of the other ways that we approach leads, some of them may have different interpretations of these guidelines as well. It's important that we are aware of those differences and that we document how we get in touch with individuals. These are some of the basic enrollment periods. We went through these yesterday in great detail, but right now we're in what's referred to as the OEP period, the open enrollment period, where people that are on an MA plan can still make some changes through the first 3 months of the year. That type of lock-in situation doesn't apply to Medicare supplement programs. So different things will come into play. And of course, there's always a monopoly get-out-of-jail-free card in certain circumstances where special election periods are available, even though we're technically in a lock-in period. This is a piece borrowed from United Healthcare that gives us an idea as to how those programs run, when they run, and what some of those rules are. Those different programs now, different carriers, as I mentioned, will take that advice given to them or the regulations given to them by Medicare, by CMS, the Centers for Medicare and Medicaid Services, and interpret it and push different pieces of information out to agents contracted with their organization. So if you work with Cigna, you work with United Healthcare, you work with Aetna, you work with Anthem, you work with whomever, be very cognizant of the communications they send to you and make certain that you're following the rules in their ballgame, because that's what makes the difference to you. Those different exceptions as to when a person can change their coverage, well, the open enrollment period from October 15th through December 7th, people can change to whatever. They're not obligated to return to the coverage that they've had during the current year, year over year. Most of them do, but once that period is passed, you then have to work through different type of enrollment periods. As we've illustrated, these are some of the exceptions that a person can use, sometimes once, sometimes multiple times, depending upon the exception. And we have a guide that we'll send for that as well. It gives you then the opportunity to help people throughout the year. Not only do we have that huge population that is aging into Medicare, you have folks that are moving from one area to another. That's a special election period. You have folks that may have lost coverage for one reason or another. Well, that's another special election period. They may have certain health challenges that qualify them for those special needs plans or other criteria that are involved. So you will see a majority of the Medicare population may be eligible for one special election period or another. Does that mean they need to exercise that every time? Not necessarily. We have to make certain that we do a fact finder and we do what's appropriate for our population, for our book of business, for the people that we deal with. And that gives us then the opportunity then to be a true advocate for our prospects and clients. And Mother Nature even kicks in every now and then. So in certain areas that are affected by, or were affected by Hurricane Dorian, you've got a county by county list that will come to you that will give you an idea as to where this special election period comes into play. Not much time left in it, but we want to make certain that you give you that information. As we talked about with the people that are continuing to work past the age of 65, they then may have questions about the health insurance marketplace. There's some information made available to you for that. Keep in mind, The enrollment periods for open enrollment periods for Medicare and for the marketplace do overlap to a degree and may cause some confusion, but we need to make certain that people realize that if they have Medicare, they're covered. It doesn't have anything to do with the marketplace. You may have folks that are deferring their Medicare coverage, and so that gives us some different play as to what people should do. So we need to have the information available as you run across those individuals to properly counsel them as to their choices. Some of the other websites that can really be of help to you, these are government sites here that can really help as to an explanation of benefits in different circumstances, and even help them find out if they're eligible for additional assistance. The benefits checkup piece from the National Council on Aging is very helpful in that regard. And some carriers actually even work hand in hand with that organization to help sponsor some of that. So you've got different resources that are available to you that you can use to your benefit, and obviously to the benefit of the folks that are visiting with you. Some additional reference material. This gives you that information for the marketing guidelines, the product pieces that I referred to earlier. You can actually go into this website and order different pieces to use in your marketing efforts. They got a really great calendar that's available for you without cost that they'll ship directly to you. They'll let you order one Medicare and You book, not in volume, but there's different materials in there that would behoove you, I like using that word, behoove you to go to that site, visit, and see if there are different things in there that can help you market effectively and correctly and compliantly using government supplied material. So everything that we've talked about, a lot of it deals with Medicare overall. A lot of it deals with the Medicare Advantage and PDP space, the C and D coverages. There are different types of materials available for Medicare supplement programs available through many of those same sites. So we want to make certain that we have all the information we need to positively discuss the options people have, and this information is available there too. This will give you also some overview on the different types of Medigap policies, because remember, as we go through and we do our diagnosis for the people we visit with, they're looking at different choices, and we need to make certain that we know how to discuss the different types of coverages they have, and this can help you in that regard. The Medicare supplement space is being affected by a piece of legislation that was passed in 2015 and is now in play for us in 2020 moving forward. It doesn't really affect the folks that had been on Medicare in the past, but if someone is new to Medicare starting the 1st of January, they have different choices when it comes to a Medicare supplement than folks that have already been on the coverage. This will give you an idea of who can get what with the Medicare in the Medicare supplement world based on their eligibility, base eligibility from Medicare. We help you in that regard with additional tools to give them the information they need on different Medicare supplement programs through our contract with CSG Actuarial. This is a tool that's made available to our agents without cost that allow you to run quotes on different carriers' coverage by plan type, by area, by health circumstances, and it gives you then an idea as to what programs you need from what carriers to be competitive in your chosen market. It's also a great way to do a Medicare supplement review for your prospects and clients. This tool also lays in different e-applications in that area as well, helps you cross-sell with final expense, hospital indemnity, and dental programs. If you are discussing the C or D programs, it also gives you an opportunity to access the form you need to have signed for that discussion to happen and a way to store it. That scope of appointment is required for every appointment that discusses those types of programs, Medicare Advantage, prescription drug programs. It also sets the tone for other products that are available for discussion at that time. You can discuss other health programs. You can't discuss like long-term care or life insurance during that same conversation during that same appointment. It also gives you a way to store that information because the government requires that we do that for a 10-year period, whether we sell something or not. So this is a great way to use that and cross-sell off of it. If you run into circumstances in the Medicare Advantage space where a person is very solid with their current choice, it gives you an opportunity to cross-sell utilizing some of the functions in here. Recordings for these type of trainings on this particular piece is made available to you. Because keep in mind, we don't want to put all our eggs in one basket. We want to have opportunities, and things vary for an individual. One choice doesn't cover all necessarily. So this gives us then some ideas as to, well, gee, what do I sell them? Well, that's a discussion with your prospect and client, and this gives you an idea of some of the differences between a Medicare Advantage program and a Medigap program, a Medicare Supplement program. Some of the chief differences you'll see are networks. Medicare Supplements, unless they're a Medicare Select plan, don't normally have a network requirement. Medicare Select may have an arrangement with a certain hospital. Generally, Medicare Supplements, it's accepted by anyone who accepts Medicare as a provider. Referrals aren't necessary, so you don't have to deal with the network restrictions of some of the pieces with that. It gives you an opportunity to access this type of policy without underwriting during certain time periods. It may be based on age, or it may be based in certain states on your birthday month. Different things come into play, and that can change or vary from state to state. Remember, with a Medicare supplement plan, there's not a Medicare supplement plan currently available for sale that has any type of prescription coverage. So a lot of times when you're discussing MedSups, you're going to talk Medicare prescription drug plans, you're going to need that scope. And that's a different type of program, and it's a different expense in addition to the premium charge for the MedSup. Medicare Advantage plans are generally network-based. Many of them require referrals to see the specialist, and those restrictions can come into play as you travel. So emergency coverage is generally handled across the country. There may be certain coverages worldwide as well, but there are certain time periods where a person can make that choice. Remember that SEP discussion we went through. In many circumstances, a key differentiator between MA plans and Medicare supplement plans is the fact that the Medicare Advantage plans may receive their reimbursement from the government to the point where they're not charging an additional premium. They will have co-pays, co-insurance, and deductibles in most circumstances, but that can vary depending upon the type of Medicare Advantage plan and the qualifications of the beneficiary. Most of the Medicare Advantage plans have that prescription drug program integrated into the base medical coverage. If they don't, it's an opt-out generally of those coverages for prescription drugs if it is a network-based program. So some different things that will come into play. What's best for an individual? Well, gee, that's kind of up to them. What are they looking for? What are the doctors that they use? What's their budget? One of the challenges you have in the Medicare space is, remember that median income for a Medicare beneficiary is $26,200. They may not be able to comfortably afford an additional premium of sometimes into several $100s, depending upon how old that individual is, in a Medigap plan, and the Medicare Advantage program might be their best choice. It depends upon the circumstance. The government is giving us tools to help us in this regard as well. What we see are tools available, plan finders. This is some of the things that I was referencing earlier. This was the first time in a number of years that we have changed or see a change in this tool. This gives you the opportunity to go in and help people compare all the programs that are available in their area. That might be a challenge to you as an agent because you might not contract with them all. Some of them might not be available to a broker even, but we want to do our due diligence. This is a great way to help them investigate different programs that are available and what they cost. You can go in there and help find plans. You can still do things on a generic basis. One of the chief changes of this tool year over year from the past is the fact that they encourage people to create their own account. And in the past, we could have done some things with different numbers. So you have a bit of privacy concerns, and we want to make certain that we're following those guidelines as well. But it's a great tool to find out who offers what and where. We also offer a tool that will allow you to do some of those things remotely when it comes to collection of the scope of appointment, dispersing information on these Medicare Advantage and prescription drug plans, and do it compliantly, because this Medicare Center tool can also act as a CRM for the people that you discuss programs with, and a great way to work year over year in maintaining your book of business. Just keep in mind, if you work in the Medicare space, one of the big attractions in this area is a strong persistency of product year over year, and this tool helps us do that annual review. And it also helps us cross-sell, which helps drive up that persistency as well. Studies have shown if you have multiple policies in the house, your stickiness of those programs, the persistency is higher the more products you have. They don't even have to be with the same company. You can have base medical with one insurance carrier, add a dental program with someone else. It still helps drive up your retention and your basic, for want of a better term, salary moving forward. In this, we have just a little bit of time left, but we've got a few more slides to roll through as to why you want to work these programs with us. Well, we can help you contract with them simply. If you look at a whole bunch of these particular programs, you will see, well, like United Healthcare's contract, read through it. It's 192 pages. They keep a whole bunch of information in there for past changes and that sort of thing as well. And if you're working with a number of carriers, which that's a choice you have to make. Am I going to concentrate with one company, or am I going to work with a whole number of different offerings? This might help you contract electronically, because you're basically creating a database of your information and then electronically filling different contract requests. It's a great way for you to also keep all your ducks in one row here alone. You also have the opportunity to make certain that you're protecting yourself. Much as a doctor is required to have malpractice insurance if they have half a brain, this is a way for you to get discounted errors and admissions coverage to cover yourself and your agency as well. And it's a kind of a unique program in the fact that it covers you regardless of where you're procuring your contracts. So obviously we want them with us, being that type of individual, but it also gives you the satisfaction and the circumstances knowing that if you have challenges based on certain marketing activities or whatever, this is going to give you that errors and admissions coverage across the board. There are certain marketing organizations that may add you to a blanket E&O coverage for a particular carrier, but it doesn't cover you across the way. And we want to make certain that you have that opportunity and cover yourself this way. We also help you keep your license in play. So we have bundled CE courses, continuing education courses through our association with WebCE. We also help you build your own benefit package. As an independent agent, you have different choices as to what you're going to do for yourself. This is a way to get non-cancelable DI coverage, disability income coverage, on a modified guarantee issue basis at a discounted rate where you even share in the commission and guarantee your personal ability to print your money. Much as today's presentation is being recorded, we do these type of presentations with carriers for products. We also do them for different marketing techniques, and they are available for you 24/7 on our website at premiersmi.com, and they're also available on our YouTube piece as well. Those electronic tools can be very, very effective for you. There are a number of us that like tactile type of approaches. Man, I like a piece of paper. My folks want that. They want a copy, that sort of thing. I got to tell you, in the long run, if you can get accustomed to and proficient at working through these e-apps, it helps your policyholder get their coverage sooner and easier, helps you with delays because they're automatically vetted and, and scrubbed. They won't let you submit in different places unless it's complete. And this is a great way for you then to have all the marketing material you need, regardless of if you're going out of your home area into an area where you're licensed and appointed to offer product that you don't have physical material. That same type of assistance is so available and so helpful in the Medicare Center program, where it can act as that database for you as well. Because you may choose to offer multiple programs, this gives you the opportunity to see what additional payments are available to you through different carriers, through the trips and incentives that the carriers offer. The Medicare Advantage and PDP programs, well, since that compensation is standardized by the government, those aren't generally part of those, but MedSups are, the other ancillary programs are, and those type of programs also help you qualify for the Premier Producers Convention, which this year, hey, it's a cruise from Miami to the Bahamas. We're about to announce the program for this year, and boy, if you're a sun worshiper, you really want to keep up on those. We also help you get in front of folks to visit with them about these different programs, to discuss the Medicare world. There are contact lists available to you. You can cold call for MedSups. You can't for MA or PDP programs, but we can help you with those lists, butt them up against the do not call list, or create a contact list that you can mail off of as well. Those are available to you at either a low cost or no cost at all. And we've got different training programs that can help you become a center of influence in your own community. You're the subject matter expert for your chosen market. You can do those through retail marketing programs. Walmart's still going on in certain areas. Different retail opportunities in conjunction with specific carriers that have those programs as well. We also help you with the centers of influence, much like faith-based organizations, where we have an approach set up for that, where people will respond to outtake there that they may not have in other areas. So different approaches, and even the presentations for webinar or seminar selling in those areas. Also different opportunities to work with different providers, not just the doctors and hospitals that deal with some of the base medical, but also like dentists for some of those programs. A way to get in front of people through whatever door or window is necessary for you to create that relationship. Some carriers will give you additional assistance and maybe even prospects. A lot of that depends upon your relationship with that carrier and the trust and the credits you have with them as well. So it's important to work with quality carriers and quality organizations to get that going. Internet leads are the real hot thing right now. We've got a great program going in our final expense area. If that's something that's of interest to you besides Medicare, we'll set you up with those folks as well. We're introducing that into the Medicare space. And we do offer direct mail support too. Based on production, we deeply discount the cost of a mailing. All this said and done, we want an opportunity to work with you. We want your business. There are additional insights in specific markets that can be really helpful for you. There are programs available within the industry where you can be certified by Council on Aging and different things that come into play. There's one of the questions that popped up about recognized credentialing, about offering Medicare programs, and send some additional information on that as well. So all that said and done, with all this information jammed as quickly as possible as we could into an hour, we want your business. A lot of it depends upon what you're willing to do as well. Medicare space, you see some of the rewards, you can see some of the nice commissions that can come out of it, the great persistency and retention of these programs. But there are other things that come into play. We have to be prepared to pay the price in order to do so. And so, if this is of interest to you, if there are pieces of this area that are of specific interest, we can make certain we get you that information, but make the decision to make this a part of your offering day to day overall, because it's a great year-round activity. And once you determine that you want it as part of your personal marketing plan, it may aid you in other portions of your marketing efforts as well. Might help you sell a life insurance, might help you with property and casualty. There's a whole bunch of ways this can be a door opener for other things as well. You need to look at the area, commit to it. Let's get you the information about the different companies and the compensation and requirements that they have, and let's put it in play. You can reach any of us here at Premier through our toll-free number at 1-800-365-8208 or through our website at premiersmi.com. Keep in mind, the recording and a lot of the material we access through the course of this presentation is going to come to you by email. You respond to that. We'll reach out to you. We want to talk to you about the possibilities you have of using this as a great way to build your agency. The different questions that have been put in the box, I think we've covered them all, because remember, you are getting copies of this. And we're doing pretty good. We've had some audio challenges the way it sounds. I don't know if that's the phones that come into play or what it is, but the presentation is being recorded and you'll have a chance to review it as well. All that said, I want to thank you for the investment of time you've placed with us today. We look forward to discussing the possibilities we have together with these programs, serving a great portion of our population. It's a great part of our market. We want that opportunity with you. So that said, until we have the chance to chat, we want to wish you a good day and happy selling. Thanks so very much, and we'll talk to you soon.